Okay, I just started recording. So if we could, why don't we get going? I had a chance to chat a little bit before we started, but the real purpose of today is to give an overview of IBI's resources and capabilities that are available to the Alliant Group. I'm Tom Perry. I'm president and co-founder of IBI, and let me jump into it with some context from the employer perspective. And here's what we observe going on, and it has been going on now for certainly since healthcare reform has really gotten steam. In 2013, we saw employers spending a lot of time around tactics, particularly around financing and coverage related to the ACA. And as they make those decisions, they are moving into the more strategic discussions about what do we do about managing health and what are we going to do about understanding the outcomes of health that are particularly important to our business. So I think employers are recognizing there's a difference between the decisions to finance healthcare and what they do on that side, but also their decisions to manage health and understand what health brings to their business. And I think that's really driven by CFOs and CEOs. That is, the conversation has expanded from the cost of healthcare to the value opportunity in managing health. And many of the employers that we work with have come to understand that trying to manage costs by managing claims in separate programs is really a dead end. Can't manage cost by managing claims. You can only manage cost by managing health. And they tell us they really need new strategies to improve workforce health, but they also understand that they have to make a business case for what that brings the business around lost time, performance, productivity, business outcomes, and the like. And they always tell us that they have limited data, limited time, and limited money. So a lot of our work at IBI, as you'll see, is really focused on helping employers get from where they have been to where they need to be in this broader value-based conversation. But I want to emphasize that what IBI doesn't do, we are not a consultant, we're not a wellness company, we don't provide solutions to employers. That's, of course, what folks like you do. We believe that if we can help employers understand these broader issues using data and analytics, then we've added value to the conversation and our members. So our role is really, and our goal is, as employers, really focus on the question of how do we create highly performing organizations. We want to show them how workforce health, absence, disability, performance, and productivity contribute to that ultimate goal of these businesses. Today we serve about 950 corporate members, and our work spans a variety of areas: research, benchmarking, modeling, measurement, case studies of employers, a variety of things that I'll touch on today. I'll spend most of my time around the tools, but I will give kind of an overview of some of the other things that we do and talk about the opportunities we have to work together. As I said, our membership is about 950 members, 948 as of yesterday. As you can see here, employers represent the overwhelming share of our members, and employer organizations, both employers and coalitions and institutions, represent about 90% of our members. The other 10% of our members are supplier members like Alliant, represent the complete spectrum of organizations that work with employers. So we have major health plans, major disability companies, consultants, brokers, wellness, disease management, workers' comp, the whole gamut of organizations that are working with employers in the broad area of health, but understand that they have to change the conversation with employers about the value of what they bring to the employer strategy around managing health. We are governed by a board of directors. As you can see, it's a rather large board, But the really interesting thing about our board, really there are two things. One, as you can see in red, we have a very strong group of employers that sit on our board of directors. Some of the real leaders from the employer side on the discussion of health and productivity. So the chair of our board is Walmart, Chris McSwain, who I've always seen since I've known Chris for the last decade as a real leader and visionary in this discussion about workforce health and what it means. The other interesting thing about the board is you'll see the stakeholder members that represent our board on the supplier side, a wide diversity of companies. So the point when we started IBI 19 years ago was that we wanted to have a large collection of employers and a very diverse group of suppliers so that no one industry segment dominated our work, so that we could truly be independent in the work that we did, and I think we've accomplished that goal. This is a screenshot of our website. For those of you on the call that don't have access today, I'll have my email at the end of the presentation. You can email me. We'll get you set up to get access to the website. That's how you're going to get access to the things that I'm talking about today. And just as a quick overview, the tabs here really get you to the things that you'll want to get to. The two keys from the standpoint of working with us are the Research and Resources tab and the Tools. And as I say, I'll talk about the tools a lot. As you see down here, what we call the Knowledge Bank, this is a way to search our database of information to get access to the things that you need, whether it's research or case studies or the like. This is a way you can actually search what we have available and get access very quickly, either through specifying a search term here and hitting search, or by clicking on one of the words in the word cloud. The size of the word has to do with how often people are accessing our information around that topic. So it's a great way to get access to information that you're looking for as you work with your clients. Very quickly on the research side, there are really two broad areas of the research that we're doing. One is, I guess what we might say, is expanding the health and productivity model. That is how health impacts things like absence and performance and disability and the like. We have in the last few months acquired two large databases that are longitudinal in nature. That is to say, there are multiple years of data integrated at the employee level. And that actually allows us to look at, as employees' health changes, what happens to costs and lost time and those things. It's a very important part of our research function to look at things over time so we can really help make the business case. Particular focus on medication adherence and its impacts, closing gaps in care. We've got a project right now looking at better measures of workforce performance and its impact on productivity. So we still have a very strong research function. Three of us here at IBI have PhDs. My other two PhDs came to us from the RAND organization as very accomplished researchers. The new areas of work really are expanding this conversation beyond the traditional view of health and health outcomes. So as we go forward, we'll be working more and more on things like how does corporate culture impact health and business performance? How does employee engagement fit in? How does employee well-being fit in? We also work in the area of data and measurement. As I said earlier, we're finding that on the one hand, employers absolutely understand the importance of data. They often are overwhelmed with data in some areas, don't have data in others, and oftentimes have no idea what data they have available at all. So we have 3 case studies right now with employers to help them really create the basic set of health and productivity metrics that they can really understand the leading indicators of health, the care delivery indicators, and the lagging and the outcome indicators of health. So that's our research function. We put research out every 2 months at least, sometimes every month. And so I think it's, getting on our distribution list will get you access to that information as well. So let's turn to the tools, the kind of pragmatic nuts and bolts of what IBI has to offer. And as we've worked with employers over the last decade, we find that there are three basic questions that are emerging for employers that our work particularly fits well with. The first is around absence. I think the economy, the fact that employers have downsized, real recognition from employers that absence is a big issue. That is, it really matters to their business whether people show up or not. Oftentimes employers don't really have a very good sense of how much absence there is in their organization. And that's one of the areas that we've really focused on, both through a modeling tool, what we call the absence cost estimator, and I'll talk about that, as well as a measurement tool, our benchmarking program. We'll spend quite a bit of time on that. Second area that we hear from employers is around chronic health management. Now, that's not a new topic. Employers for a number of years have focused on managing chronic disease because chronic disease is the big driver of medical costs. But what's happening now, I think, in this broader context of the question of what's the value of our investments in managing workforce health, whether it's chronic disease or wellness or whatever, is how does chronic disease impact outcomes beyond healthcare costs? Things like absence and performance and the like. So again, modeling tool we call the Health and Productivity Snapshot, a measurement tool that we call the HPQ Select. It's a tool that we developed with Ron Kessler at Harvard Medical School that employers actually can use to measure these dimensions in their own workforce. And the final big question is around the total economic burden of health. What does health mean to my business? This, I think, is driven to a great extent by healthcare reform. The question from the employer, what do I do? Do I stay in? Do I get out? Do I just send my employees to public exchanges, private exchanges? Those questions are real to employers, but in our mind, you can't answer that question without really understanding what health means in your business. It's kind of back to that issue of financing healthcare is one thing, managing health and outcomes is another. So we built a model, we call it the full cost estimator, and I'll talk again about that in a minute, that actually helps an employer start to see quantitatively and economically what health means to their business. So back to the website and the tools tab I mentioned, if we click on that, we really see this summary, really this information, what I just talked about, the basic questions and the tools. And it allows our members to get to a tool that matches their needs quite quickly. But let's talk about absence first. I know there's a great interest in absence management in your organization. And I think that fundamental question of what's the real impact of absence to my business, what does it mean to my company? Oftentimes employers, in fact, I think probably most employers cannot tell you how much absence they have in their company during a particular year. So we built a model based on our own work, some of the work published by Sean Nicholson and Mark Pauly in Health Economics. It's really a simple tool around getting estimates of absence for an organization. So if we go to the website and you clicked on the absence cost estimator, you see a very simple data input form. This is online. This is available to all our members. It's an online tool. And essentially gets some basic information about the industry the employer is in, whether it's at the very high level we have here as the default, the U.S. workforce. But it also allows some very detailed analysis by industry. So, for example, if you're working with an employer and you know the 4-digit NAICS code, which is the next generation of the industry or SIC codes, you can actually enter that in the pull-down menu. Once you select the industry, it's a matter of putting in the head count for the employer and the proportion of that employer's workforce that is full-time. Obviously, the percent of full-time employees has an impact on absence. So when we run that model, here's the report that pops up. So I ran the model on a manufacturing company, at the high level, and the 3-digit NAICS code, the primary metal manufacturers, just as an example. So this organization has 5,000 workers, and 75% are full-time. So those are the inputs that actually run this model. That's all you need. And a lot of our modeling work is really built at a very high level. That is to say, does not require a lot of data, because what we find with employers, as soon as you say to the employer, if you give me a lot of data, I can really help you understand what's going on. That often is a deal breaker right from the get-go. So what we wanted to do is engage employers in this conversation without asking them for a lot of data, but still intrigue them by what all this might look like and what this might mean. So this is the report that is generated by the absence cost estimator. You can start to see some of the things that the employer can learn around the cost of absence. So in this case, absence would cost about $7.4 million. The cost broken down into the two key components: wage replacement payments, because obviously employers pay employees when they don't come to work for purposes of health, whether it's sick leave or short-term disability or workers' comp disability, and then lost productivity. This lost productivity estimate here is based on peer-reviewed research literature in the health economics literature. And then finally, the effective wages and benefits per lost workday. But then we get down into how much lost work time. So in this case, about 27,500 days of lost work time, and lost work days per FTE, 6.3 days. And the final piece of this little report is around, well, if the employer improved absence by different target percents, 1, 2, 5, and 10%, what would it mean by way of financial savings, and what would it mean by way of workday savings? The financial savings are particularly important to CFOs, but workday savings are particularly important to the operations people. So it's a great way to engage an employer in a conversation with some high-level numbers. And oftentimes employers are really flabbergasted by how much absence they might have, but particularly how much absence really costs when you bring in the lost productivity discussion.
So, Tom, can I ask a question? This is Holly.
Sure.
The cost estimator, does that take into account things like incidental absences, or is that strictly health-related absences?
Well, it's health-related, so sick leave would be included here. What wouldn't be included here are vacations and holidays and that. So this focuses around health.
Okay.
Because I'm sorry, go ahead.
So it, is some FMLA days are not health-related.
This does include FML as well.
It does?
It absolutely does. So it's in FML, it could be the family member's health condition or the employee's health condition, but FML is included in this estimate.
Okay, so it basically is any unscheduled absence?
That's essentially correct. Although, you might consider short-term disability. It depends on whether you consider short-term disability scheduled or unscheduled. Right. But what it includes is sick leave, short-term disability, long-term disability, workers' comp disability, and family medical leave. Those are the components that are included here.
Okay.
Good. Now, as we get to kind of the measurement side and benchmarking, so, we tried to build these as kind of a story in engaging the employer in wanting kind of more information. So oftentimes when the employer sees the absence cost estimator, one of the things that comes into mind is, well, how do I compare to my peers? And that's where our benchmarking information and our benchmarking database comes into play. So IBI has built the largest benchmarking database and benchmarking program in the country that combines information both for occupational benefits and non-occupational benefits. We've been able to do that because we get claims-level data from what we call our data consortium members. So these companies, these 13 TPAs and insurers, provide us claims data, by and large, for their book of business in the mid-market, in the large case market. And in doing so, it allows us to build very large benchmarking databases. So, for example, the most recent database we have, about 52,400 employers represented in the database, almost 4.4 million claims, and almost 900 individual industry groups. And we show here for the 4 programs, workers' comp, STD, LTD, and family medical leave, those are the 4 programs included, the number of employers we have in the database, the number of claims, and the number of industries that we can benchmark. So this becomes a way to take the next step and help an employer understand what's going on in their industry and hopefully engage that employer in actually participating in providing data to benchmark their experience. The benchmarking focus really is around incidents, lost time duration, claims costs, but there's also, as you'll see in a minute, contextual information around plan design for STD and LTD. We have the ability to get down to geographic location as well as diagnoses. So it really provides a very rich data source to help an employer understand their industry group and if they have their data available to actually benchmark their own experience. When we go back to the website, we click on Tools, we click on Benchmarking. This is what we see, and I'll actually take you into the website in just a minute to show you how to navigate that. But it's a very simple kind of point-and-click structure. The first is to select the year for which benchmarking reports are desired. So we have 3 years of data always on the website. Then to select the benefit program you're interested in. In this case, we selected short-term disability. And then the area of interest by way of the employer's industry. And you'll see in a minute when you select an industry, you'll see within that industry all the subgroups that we have available for benchmarking reports. So this is a way to get people started in a very simple kind of point-and-click structure. But let me, before we go into the website, just give you a kind of a quick overview of the reports. So this is an STD report. So we've selected, I think we've run this report for all the employers on the database. And you'll see the report is organized in the first instance around some basic questions. How well is the program working? A variety of metrics around incidents. So, for example, new claims per 100 lives, active claims, etc. For each of these areas, these metrics, we have a number of different statistics. Typically, people often look at the group average or the mean value when they want to get a measure of what's going on a particular metric. We also show next to the mean the median. Now, the median is the 50th percentile. And why do we do that? Why do we show both together? We do that because in claims data typically are quite skewed. That is, they're not nice bell-shaped curves that we always used in statistics classes. They tend to have either outliers on one side, that is either expensive cases or long-duration cases, that is the tail, if you will, or on the other side, that is very inexpensive cases. So you don't have that nice bell-shaped curve. And we want to give our users the choice of these 2 measures of what we call central tendency, whether it's the mean or the median. So oftentimes when you see a big difference between these 2 numbers, people often will use the median value so as not to be influenced by outliers. It's up to the user, but we always want to have those 2 statistics right together so the user can get a sense of how skewed these distributions are. But we also show the percentiles because this is where you start to get a sense of the underlying distribution. And particularly if an employer has their own data available, they can start to see where they fit in. And, I think everyone can kind of relate to percentiles because probably back in high school everyone took some standardized tests. And if you're at the 90th percentile, that means only 10% of the people have higher results or better results than you. So it is a way to help understand what that industry group actually looks like. So for each metric, we always show those measures, those statistics. But we also show the number of employers that went into the calculation and the number of claims. So we always want people to be aware of what data were drawn upon to create that measure. The fewer employers, the fewer claims, the less confidence you have in that particular statistic. So our reports are all structured this way. In this case, we also show how severe the cases, which are really just measures of cost. How much lost work time does the program generate? Again, various measures of lost work time, the same structure, and how successful is the company returning people to work. So the reports are structured this way. In STD, we also, and this becomes very important in talking to employers, we have information on plan design. 2 dimensions right now, the elimination period as well as the maximum duration of benefits. When we collect data from our data consortium companies, we get this information. We essentially build a typology, if you will, of plan designs based on those 2 dimensions so we can actually help people understand what's going on in their industry. What kinds of plan designs are typical in their industry? And that becomes very important to employers. Employers like to know what their peers are doing, and this is a way to get at that issue around plan design. And then finally, in the reports, we have information on diagnoses at the MDC level, the Major Diagnostic Classification. So the 2 features that we find employers really want to know about are plan design as well as diagnosis. So we have information around diagnoses for the closed claims in the database, percent of closed claims, percent of payments, and then around lost work time, both mean and median calendar lost work days. So the reports are structured in that format, whether it's STD or workers' comp or FML. FML is a little different because the program is different, but getting at the reports and kind of the layout's pretty much the same. So with that, let me actually take you into the website. And as you saw from one of the screenshots, this is the website. So I'll click on Tools, and then I'll click on Benchmarking. Okay, now this is another screenshot you saw before. So what we'll do here is we'll select a year. We'll select 2012. We'll say we want an industry summary report. And now it is loading the database, allowing us to select, let's say, short-term disability. And let's say we're working with a manufacturing company. So we'll click on manufacturers. And then click on Proceed. And it will then give us information on the subgroups within manufacturing that are available from a benchmarking standpoint. So you can see here for each group, we have the name of the industry, but also the SIC code. So you can see SIC codes are arranged hierarchically. And so in this case, we show in the food area, SIC code 20, 201, 208, sometimes down to the 4-digit SIC code. And so it allows you to actually find the subgroup that most closely matches a client. And you can see here we have a variety. We've got a lot of manufacturers, and so it can take you through the different manufacturing groups as well. So let's just, for this purpose, we'll select all. No, we won't do that. That's too many reports. We will select, for the sake of discussion, let's just take textile manufacturing, and then we download the report. And so it's a very simple way to get access. And here's the SIC code report that I went through. So it's a very simple and easy way to get access to benchmarking data. And what I always recommend to our members is when they're going in and talking, particularly to a prospect or maybe a new client. Oftentimes, and I hear this all the time from employers, a vendor supplier comes into their office, and the first thing they talk about is all the services they can provide. And with this kind of information, you can actually go in and be an industry expert, if you will, on that company's industry. You can share with them what's going on in their industry around, say, STD or FML or workers' comp or whatever it might be. And it tends to change the conversation, certainly. But it also can then lead to that conversation about how would you like to know how you compare with your industry group. And once an employer engages in providing data, it really allows a new conversation about how do I compare, where am I doing well, where am I not doing well, and what are the strategies that I might be able to employ that would help me do a better job. So the benchmarking information, it's all real time. You can be anywhere on a tablet, on a computer, your client's computer, and download a report and talk to that client about their industry and what's going on in it. So before I leave this, any questions about the benchmarking website and how to get information from it?
Is there any reason I've run several of these reports, and I wasn't able to download them. I had to request them and have them sent to me.
Really? Then that's probably a setting on your side.
Okay.
I would look into that because we certainly haven't had that trouble here or with anyone else that we worked with. So oftentimes, and I've seen this with my computer, a setting has to be changed in order to get that download. So
okay.
Have tech people, I would ask them, what's going on there. As I just showed you on this, it pops up down at the bottom of the screen, but every computer is set differently, and you have to look into your preferences to really, I think, understand what's going on.
Okay.
Okay. And the other thing about this, we always want to support our members, and so if you're working with a client and you have a question, or maybe it's not showing you a level of detail you want, let us know, because we will always do what we can. And that's one of the reasons that we built our databases at the claims level, because that gives us a level of control over the information and getting access to it. So any questions that you have, don't hesitate to contact us, and I'll have one of my staff follow up with you. Okay, so let's continue on. On that second broad question about chronic health, the question of, well, what does chronic health really mean? What are the broader implications of chronic health conditions in my company? The modeling tool, we call it the Health and Productivity Snapshot. This was developed with Ron Kessler at Harvard Medical School based on his work with the World Health Organization and employers and his database that he's gotten in surveying employees around chronic health and getting information on outcomes like absence and performance and the like. So as we go back to the website and we've clicked on tools, we see the various tools here. If you click on Health and Productivity Snapshot, now this is where we will work with you directly to generate these reports. This is not an online tool. As part of your membership at the charter level, access to these reports is available to you at no additional cost. So if you want to start getting into these areas, all you have to do is contact us, and we work with you to get the information from the client to actually generate these reports. And we'll actually take you through the reports prior to the time you might want to talk to the client. Maybe you want us on the phone with the client to explain things. As I say, we're here to support you in this conversation. From the data side, the key is it's kind of like the absence cost estimator. we only need two pieces of information to run this report, and that is information on the industry and the number of employees. Now, these other elements, percent full-time workers and wages and demographic information, if those pieces of information are easily available from the employer, they can be used in the model. And if we have the more detail we have for an employer, the better the estimate is, if you will. But again, we never want the lack of information to get in the way of this conversation. So we always try to make this easy and straightforward, but when there's more information, it really kind of brings it home to the employer in a very real way, because it's more and more about their organization, which of course is important to employers. When we generate the snapshot report, this is what you'll see. You start to get information on chronic conditions. That is, how many people in the organization have how many chronic conditions. This is often a surprise. So as you see here in this case, and I think this is, we did this one on federal workers in one of our partnerships. This would tell us that almost 3/4 of the employees have at least one chronic health condition. Now that often just jumps off the page because people think, well, wait a minute. The statistics that I've seen say that only maybe 25 or 30% of employees have chronic health conditions. Those statistics are always generated by looking at medical and pharmacy claims data. This information is derived from information directly provided by employees through Dr. Kessler's Health and Work Performance Questionnaire, which is a research-tested questionnaire. The questionnaire asks employees about 27 different chronic health conditions, some of which are what we might call diagnostic, heart disease, asthma, diabetes, cancer, but some of which are more symptomatic: depression, fatigue, back pain, sleeping problems. The reason Ron did that is oftentimes these symptomatic issues are key in driving absence from work and reduced performance at work. So he took a very broad view of chronic health, and furthermore asks employees not what has your physician diagnosed, because as we know, a lot of employees don't see their physician around their health conditions. But he asks them, what conditions do you have? And that's why you always see in this analysis a much larger share of employees saying, I've got a chronic health condition, than you do in the literature around medical and pharmacy claims. So for federal workers, for example, almost 40% have at least 3 chronic health conditions. And what's interesting, when we look at treatment, only about 30% are currently being treated, and about 35% have never been treated for the condition they say they have. So this starts to raise this discussion to the employer of where you're getting your information about chronic health and treatment. And if you're only looking at medical and pharmacy claims data, you may be missing a very important part of your employee's health. We look at chronic health conditions by way of prevalence and break that down by treatment patterns as well. Had the condition never treated, etc. So now we're looking at the incidence side of chronic health, how often these things happen. But then we want to get into the cost side. Now, one of the key parts of this discussion around health and productivity in chronic health is thinking about kind of whole people, if you will. So in this exhibit, we break this down by chronic health condition for people that have each of these conditions. So the people that have depression, now they may have other chronic health conditions as well, but the people that have depression, we break down the costs of both absence and presenteeism and performance. So we look at the chronic health conditions by way of their cost for people that have that condition. And then we get down here at the total costs for the conditions themselves: depression, chronic fatigue. And as I say, this is all federal workers, so the numbers are quite large. So it's very important to distinguish between the person-centric view of chronic health, because as we saw earlier, people tend to have multiple chronic health conditions as opposed to the disease-specific view. Now, the final piece of the report is looking at that disease-specific view because we utilize a statistical algorithm to essentially segment out the marginal impact of each of the diseases. So we report all the 27 chronic conditions, the percent with the condition, the percent in treatment, the average number of other conditions, and that becomes really important in thinking about treating people rather than treating individual diseases. And then net loss work days and net loss productivity costs. So it's a wealth of information, again, driven by just a few data items. But, I always underscore this is a model that's whole purpose is to raise new issues for the employer and eventually hoping to lead the employer to think about how can I get this kind of information actually on my own workforce, because that's where it has the most power. Any questions about this?
Tom?
Yes.
Tom, hi, this is Mike Seifert.
Hi, Mike.
I was wondering, in the case of that presenteeism, without getting, too much into detail, I guess, on the modeling, like, so I was particularly interested in the proportion of, absence and presenteeism by those chronic conditions, the prior slide. Like, what is that presenteeism based on? I mean, is that based on actual data that somebody reported that they, came to work and they're afflicted with that chronic condition?
That's a great question, Mike. And here's the presenteeism estimates are based on measures of performance that are self-reported. Now, Dr. Kessler, when he built this survey, this interview survey, has a series of questions about an employee's performance in the last 30 days, as it compares to their typical performance, as it compares to the performance of other people in their organization with the same job, as it compares with the best performers in their job. And that information is used in generating an estimate of reduced performance during that 30-day period for that employee. Now, we take that estimate and translate it into lost work time, which is a very simple transformation. But then we apply a model to essentially monetize that lost work time as lost productivity. And that monetization is really based on an opportunity cost model developed by Dr. Nicholson at Cornell. And what that really means is when employees don't come to work and are absent or are at work and not performing, the employer has a decision to make with regard to, do I make up that lost work time either with a bigger staff, with temporary help, with overtime, or do I just try to make do and take the risk of losing revenue? And so this model, essentially, which is based on research with 800 employers, actually develops estimates about how employers respond by industry to those various things and monetizes that. And that's where this productivity cost feature comes in. Is that reasonably straightforward, Mike?
Yeah, no, I actually appreciate that, Tom. And interestingly enough, as you were describing the type of question, I'm fairly certain I've taken that survey.
Well, it is a research-validated survey. There are a lot of surveys and tools out there that vendors have developed, oftentimes with no real research validation. That's one of the reasons that we worked with Dr. Kessler. We've also have done some work with Dr. Lerner at Tufts. And Ron Kessler and Deborah Lerner, in my mind, are the two leading academic researchers on this topic, both of which have done research-validated studies using their survey tools. It is self-reported data, but it has been validated through research. And again, the purpose of this is to essentially get employers to understand there are additional costs to employees either not being at work or not performing at work. And that's what this work helps do. It also helps the employer think about these other impacts on productivity, the chronic fatigue, sleeping problems, those kinds of things that maybe aren't treated, and it helps the employer start thinking about their own programs around prevention, wellness, disease management. And that's the conversation we want employers to have in partnership with their supplier partners, because that leads to new things and new approaches and new initiatives, and that's what we think has to happen.
Thank you.
Sure. On the measurement side of this, as I mentioned, Dr. Kessler's HPQ, we work with Ron to streamline the HPQ into what we now call the HPQ Select. It's a shorter survey, easier for employers to do. The HPQ Select, we do it in one of two ways. Either when an employer or their partner says we want to do a survey, we can actually survey the workforce. We have a survey partner called DataStat that does that work. Or we actually can build in these questions into the employer's health risk assessment. That's the more common way employers get this information. But there is that measurement piece, which actually allows the employer to get this information about their workers, and then we can work with the HRA company to actually develop the algorithms to analyze the data and report it, so the employer has information on their own workforce. Okay, finally, that last tool, the full cost estimator, the total economic burden of health, and this is one that we're probably doing more and more work with because of healthcare reform and the conversations that employers are having. And as I say, that question is, well, what does health mean to my business? Maybe I know what healthcare costs are, but maybe I really haven't even thought about what other impacts health has. And as I think about what I'm going to do about healthcare reform and keeping it, investing in it, send people outside, whatever it is, I need to have the broader view of health, and that's what this model does. Again, back to the website, the second tab, the full cost estimator, again, this is where we work with you to get the information to run the model. Same information you saw for the snapshot. Also allowing to get information on disability, STD, LTD, and the like to build this into the full cost estimator. Again, not required, but if the employer, the more information the employer has, the better the estimates are. And this is what we start to see in the way of the report from the full cost estimator. So we actually show all the costs of health, group health, presenteeism, sick leave, workers' comp, FML, STD, LTD, the wage replacement piece, the lost productivity piece, medical and pharmacy, little pie chart showing these things, always emphasizing the fact that medical and pharmacy in our research typically is about half the total cost of health, and that is often an eye-opener for employers. And then we want to break it down with some numbers below the various pieces and how big they are. Once the employer sees this, of course, they're starting to think about, all right, if I start thinking about outcomes of health, what am I going to do by way of my medical management strategy? How do I manage my medical cases? What am I going to do about disease management? What am I going to do about wellness and prevention? Because all these things are connected. And if I'm someone working with an employer, that's the conversation I want the employer to have, because I want to help the employer engage in all those discussions internally. Second page of the report starts to break down the lost work time aspects by way of FTE days and cost of lost work time, and then the detail from the disability side. So the report kind of has multiple levels with a tremendous amount of detail, but it's organized in a way hopefully not to be too dense, several graphics, but we always want to have the supporting detail right there available. So as a matter of fact, we've just gone through a revision, and an organization that wants to essentially combine the full cost analysis with the snapshot in one report. That's kind of part of what we do now. And we did that for this reason. Once an employer sees the full costs, and without question the employer will say, wow, this is much bigger than we thought, and these outcomes of health have a much bigger impact than we thought. But, of course, then the employer starts to say, well, what am I going to do about that? And so in the same report, we have that information from the snapshot around chronic health conditions and lost work time, and it helps the employer start to think about, on the outcome side, the productivity side, what might I be thinking about doing? What am I doing now? So it generates that conversation about interventions and actions, which, of course, that's what employers want to do. Finally, on the third piece of our work at IBI in kind of education communications, a variety of things. We do have a national conference. We just had it in early March. Here in San Francisco, we had about 420 or so organizations participate. More employers than we've ever had at our conference. Our conference is unique in that we don't have an exhibit hall, so it's not designed around marketing. It really is designed around research, case studies, best practices, and the like. Each presentation always has an employer. We don't allow suppliers to get up there and sell services at our meetings, but we got great reviews from this year's program. When we publish new research, we do webinars for our members and guests, and so not only are you welcome to participate, but you can invite any of your clients or prospects to participate and start to hear from IBI as the independent not-for-profit source what results from a particular research study are saying. We also, with our charter members like Alliant, do joint webinars. So perhaps you want to put on a webinar around these issues with clients and prospects. We participate in that webinar, bringing the things that we do, the research, the case studies, the perspective, which really support this conversation about health and productivity. So it's one of the ways that we support our charter members in this discussion. We also, if you remember back to the knowledge bank, that part, the right lower part of our website, if you have employers that are doing interesting things, we can do case studies on those employers, and they can be part of the knowledge bank. The knowledge bank includes both research as well as employer case studies. We find that employer case studies are a very powerful way to get the attention of other employers about who's doing what out there. So we really see evidence in two ways. One, we obviously believe that research evidence is important, but we have come to believe that evidence about what employers are actually doing and what their experience is a very, very powerful form of evidence as well. We've produced two DVDs that are available to our members, one around making the business case to the CFO, and we did that with MGM Mirage. It's a very interesting conversation with the CFO about making a business case for health and productivity management. And the second DVD is around how employers can work most effectively with their vendor partners, and we did that in partnership with Chris McSwain when he was VP of Benefits at Whirlpool. Both those DVDs are available to our members. It's really a great way to hear from employers about those two key issues. And then finally, we always want to emphasize that our member companies, our suppliers, can sponsor any of their employer clients to be IBI employer members at no cost to the employer or no cost to our supplier member. And we do that because our ultimate goal is to help employers understand what this is, what it means, and really embrace a much broader and different view of health, outcomes of health, and what it means to their business. So as the kind of private, not-for-profit research data group in the U.S., we have great credibility with employers, and it really allows us to have a different conversation with employers than, to be quite honest, any supplier can have, because we don't have a financial interest in the relationship, if you will. So it's something that we think is a great opportunity to essentially add value to clients and prospects, to say we can give you access to this body of research and tools and the like by having a relationship with you. And it's something that we always want to promote because we think it's a very good way for us to partner in helping employers really understand what this means. That's my contact information, both my email address and my phone number, IBI's website. Love to have you actually get your own user ID and password. It takes an individual user ID and password to actually get access to the benchmarking information and then work with us on the other tools. And certainly we would enjoy having you participate directly with us. And as I say, we're always available to answer any questions. So, Beth, that's a pretty quick overview, but I wanted to cover a lot of ground as a first step in getting your new team aware of what we have here at IBI and how we start working together.